Welcome to 3M Oral Care's third live webinar in the series Infection Prevention. I'm Carissa Kerr, representing our Scientific Affairs and Education group, and your host for the webinar. We are excited to go more in depth with respiratory protection in oral care settings, part 3, by focusing on fit testing. This is a non-CE course, as a reminder. Thank you so much for joining us today and your commitment to your profession and education during these difficult times. Your team is dedicated to patient care, and 3M does stand with you. You now have access to our first two webinars, Respiratory Protection in Oral Care Settings 1 and 2. This is with Dr. Carrera and Dr. Durst. By following the links you see on the screen, you will also get an email with the details if you opted in to be able to view the recording from webinar 1 and 2. The speaker for today is Eric Johnson. Eric Johnson is a certified industrial hygienist and a certified safety professional. Eric has worked for the 3M Personal Safety Division for over 25 years, and he has his Master's of Public Health degree. Also joining us at the end for question and answers, our panelist is Dr. Carola Carrera. She was our presenter from webinar 1. She'll be joining us at the end, and she studied at the University of Talca, Chile, receiving her Doctor of Dental Science as well from the University of Minnesota.
Thank you. This is Eric Johnson. Just a clarification, industrial hygienist is someone in the safety profession who looks at workplace hazards, how to measure them and control them. So just in case anyone is wondering what it is, an industrial hygienist. And some of the opening points for today's webinar, that this information is largely based off of US OSHA requirements. I know we may have a few people joining from Canada and other countries, so there might be some slight differences. So make sure you consult your local regulations for the nuances. But the topic today is fit testing, so I hope this will be beneficial and informational for everybody attending. So I'm going to be covering this topic in a little under an hour. It's not a complete overview of the subject. You still need to look at your local regulations, the instructions that come with your fit test kits. But this information is current as of today, but you still need to do your own study and follow the instructions and regulations. We also reserve the right for this presentation. It will be shown again at later times. Here's what we're going to be talking about today. The agenda of why do we do fit testing? What are some of the basics as far as the regulations that require fit testing? What are some of the methods of fit testing? Practical sense, how do you prepare for fit testing at your facility? And then looking specifically at qualitative fit testing, and I'll explain what that means. What are some of the protocols and steps involved? And then to help you out, what are some of the resources that are available? And then finally, some live Q&A. So we'll start off with why do we do fit testing? And the science behind this is that there are different ways to make sure your respirator is going to provide the protection intended. So if you look at the circles on the right and how they overlap, the first one is filtration. So hopefully you are using a NIOSH approved particulate respirator, or for those of you who are attending from outside the US and Canada, maybe you're using a European approved respirator, but somehow hopefully you have an approved particulate respirator, and that is a way to make sure that the respirator is actually filtering these very small particles. On the bottom, we see compliance, or as I'm going to describe it, wear time. In other words, are you wearing the respirator all the time that you are exposed to the hazard? A lot of that comes from user training, so they understand when they're exposed, and they're motivated to wear the respirator all the time that they are exposed. And the last circle, the one on the right, is what we're going to be focusing on today, and that's fit. Because the respirator has to fit properly for it to function as designed. We want to minimize any leakage between the face piece and the face. So you have all three of these, the filtration, the fit, and the wear time that have to work together in order for the respirator to function as intended. So when we do the fit testing, it's not just what I've just described, but also helps the user to understand that yes, they can hopefully achieve a fit on a specific make, model, or size, and this respirator can be effective to help reduce their exposure to airborne particles, and we demonstrate that during the fit test. They can learn how it feels on their face, where it should be positioned up, down on their face and the nose area, and the tightness on the chin and the cheeks. So it really is a training exercise, a familiarization period. And then lastly, it helps you comply with OSHA or your local regulations. Speaking of regulations, in the US, the respirator standard is 29 CFR 1910.134, if you want to go look that up. But in brief, every respirator program needs to have written procedures that cover why we selected this particular respirator, medical evaluations to make sure that you can wear a respirator, training on the use and maintenance and care, adequate air quality. That's more for supplied air respirators, which is outside the scope of this seminar. Have training, and where we're focusing today is fit testing, and then program evaluation. So periodically, who's ever managing your respirator program needs to actually talk to the workers, observe the workers to make sure that they are wearing the respirators properly. If they have any questions, any problems, that these are resolved. So this is a very high level overview of what's required in a respirator program, but it does require a program administrator and it does require fit testing. Now, during this pandemic, there have been some comments from OSHA, CDC, and NIOSH regarding fit testing. So start the top left, OSHA April 3rd. They said that annual fit testing isn't necessary, but you still need to do initial fit testing. On April 8th, they also suggested that manufacturers may be able to provide information about which models fit similarly. So if you go to the 3M website, you will indeed find a bulletin that says if you have already passed a fit test on this respirator, you will probably get similar results on this other model. That website is 3m.com/coronavirus, and you will find this and many other bulletins there. CDC, they have an advisory role as opposed to OSHA being regulatory or mandatory, but CDC stated that they prefer qualitative fit testing as a way to conserve your N95 respirators. The qualitative fit testing, which I'll describe in detail in a couple slides, it's non-destructive, so you could be fit tested on a respirator and then use that same respirator. They suggested that if you have expired respirators, you could use those for fit testing as opposed to just throwing them away. If you want, maybe you could defer your annual fit testing or do fit testing just in time, right before you're going to use it as a way to try to conserve both the respirators and the fit testing time and resources. NIOSH, the National Institute for Occupational Safety and Health, they're the folks that approve respirators. They're also part of the CDC. So they mirrored what the CDC had already stated as far as qualitative fit testing being preferred, fit testing just in time. They even went as far as saying during serious outbreak conditions, if fit testing is not an option, even without fit testing, a respirator will provide better protection than a face mask or using no respirator at all. So this is just kind of a brief overview of some of the more recent comments with regard to fit testing under COVID-19. So which respirators require fit testing? Basically, if the respirator you choose needs to seal to your face, it requires fit testing. So this could be disposable respirators like the blue and the white one we've shown here on the screen. It could be reusable half masks, reusable full face pieces. They all require a seal to the face, so you need to test and verify that you have the correct make, model, and size. In contrast, we see that the loose-fitting headgear that's used with a powered air purifying respirator, a PAPR, or supplied air respirators, those are not designed to fit snugly to the face. Air comes in the top or back of the headgear and it cascades down and out. So there's not a tight seal required by design, so you do not need to do fit testing on those loose-fitting face pieces, hoods, or helmets. Medical evaluation. This is, again, one of the requirements under the US OSHA, and it says that you need to have a medical clearance before you're even fit tested or wearing the respirator. Per OSHA, this needs to be done by a physician or other licensed healthcare professional. Depending upon your state, the licensure might dictate this could be a nurse or a doctor, so check your state requirements. But it must be completed before you're fit tested or wearing the respirator. But OSHA does not say how often you need to do this medical clearance. We do partner with an online provider, respexam.com, where the company who wants to use this service would go ahead and they would say, these are my employees, this is the respirator that they're going to be wearing, the tasks they're going to be doing. So they'd set up all the profiles, and then the individuals would log in separately and create or answer the questions, I should say. And based on their responses, most people are cleared right away. However, if they say something like, I have difficulty breathing while I'm walking upstairs, there's going to be some follow-up questions to determine whether or not they can wear a respirator. Fit testing frequency. So whenever a person uses a different make, model, or size, they need to make sure that that individual respirator fits. So if they change any of that, they need to be refit tested. If their face structure changes significantly from either accidents, surgery, denture, excessive weight loss or gain, they would need to repeat the fit testing. Or if the employee just says, you know, boss, this one just doesn't seem to fit right anymore, repeat it. And then OSHA says it needs to be done annually. A lot of models come in different sizes, either a regular and a small, or some of the elastomerics come in a small, medium, and large. And again, there's different makes and models that are options. Who can conduct a fit test? The good news is there's no certification or formal coursework required to do this. You do need to be able to follow instructions. Most of the fit test kits come with instructions right in the kit, and there are also training videos. All fit test administrators need to be able to follow the instructions to perform the test properly. They need to recognize when something's gone wrong. They need to make sure their test equipment is in working order. For the qualitative tests, and I'll explain those more in detail, they need to know how to prepare the test solutions. Now, just recently, NIOSH has published this link with how to make up the fit test solutions if you run out. Most of the kits come with their own stock solutions. You can order more, but I am aware that in the past months, these have been scarce, so NIOSH published the ingredients on how you would make these yourself. In the OSHA Standard for Respiratory Protection, 1910-134, in Appendix A, OSHA also lists the ingredients, or the recipe, if you will, for the fit test solutions. For quantitative tests, so this is using a machine, you need to know how to calculate or interpret the fit factors and also do calibration on the machine or have it sent in for calibration. So fit testing methods. We've talked about qualitative and quantitative. So qualitative means you're looking for a taste, a smell, an irritation. I'm going to be focusing today on the saccharin mist and the Bitrex aerosol because they are most commonly used for particulate respirators. I'm not going to talk very much about, there's an isoamyl acetate test, or also called banana oil. I'm also not going to talk about irritant smoke because it's also not as popular. But for the qualitative test, the saccharin and the Bitrex, we see the person in the upper right wearing a hood And then the administrator of the test has a nebulizer with some solution in it, either the sweet or the bitter. They squeeze the bulb, it creates a mist. And this is effectively a taste test. The taste indicates whether or not the respirator is sealing properly. For quantitative, we're looking for a number. So you need a machine to assess the fit of the respirator. One of the more popular models is the TSI Port-A-Count respirator fit tester, although there are other brands. This is one of the more popular ones for particulate respirators. It's shown here where there's a machine that's connected via 2 tubes up to the respirator. The blue tube is just measuring the particles in the outside air. The white tube is actually connected to the respirator. There's a hole that's punctured in the respirator, and it's drawing a sample inside the respirator. So this gives a ratio of the particles outside to the particles inside, and that is your fit factor. Now, for half-mask respirators, be they disposable or reusable, you need a fit factor greater than 100 for half masks. For full face pieces, you need a fit factor greater of 500. Now, because there's a hole in the respirator, this respirator cannot be used then for actual use, which is why CDC in the previous slide, we mentioned that they don't recommend this if you have a shortage of respirators. It's great if you've got plenty of respirators to do the fit test, but you are putting a hole in the respirator, so it can't be used then for actual use. OSHA accepts either the qualitative or the quantitative methods for determining whether or not the respirator fits. There's also, for quantitative fit testing, controlled negative pressure fit test that's used for the elastomerics, but not for the disposables. Now we're going to go some of the practical steps for preparing for a fit test session. So before the test, you will want to send out a notice to whoever's going to be fit tested to allow them to ask questions, to make sure they're clean shaven. We see the nice picture here from NIOSH, but basically wherever the respirator touches the face and is going to seal to the face, you need to be clean shaven. So yes, you could have a very short mustache, or I'll call it here a soul patch, but any facial hair or stubble that's going to be in the way of the sealing surface of the respirator needs to be shaven prior to the fit test. We're going to be talking here about qualitative fit tests. So they need to avoid eating, chewing gum, smoking, or drinking anything except for water for 15 minutes prior to the test, because these are taste tests. Medical evaluation needs to be completed. And if you have them, it's great to have several models and sizes available. So if they can't fit on model A, maybe they can fit on model B. And in your mind, prepare. This is also a great time to do training. You have a captive audience. So you can talk to them about the importance of wearing the respirator, wearing it all the time, how you're going to do cleaning and maintenance on some of the reusable respirators, etc. So in your mind, prepare for this opportunity. For the setup, just again, some practical tips. Have this a private area away from a lot of people walking through, but make sure it is accessible for the people you do need to come. It should be a clean area. There should be hand washing facilities, drinking water, and a waiting room for the test subjects. For the room itself, you're going to have a flow of an admin or someone to regulate the flow of people, an area for doing the sensitivity tests, for doing the conditioning and fit testing, and after that for the documentation, your paperwork, and then an exit. So there should be a flow pattern that you have for this area. You have all your supplies, your fit test kits, your respirators, your razors and shaving cream if necessary, sign-in forms. Some places, they'd like to have cards where the people can keep track of, this is my respirator, make, model, size. They might need some cleaning equipment if you're going to be fit testing with reusable respirators, pens to write down, or however you keep track of this information. So if you're going to be doing more than one person at a time, that is possible. In pre-COVID fit testing, we would normally line up, say, 5 people in a row and have the fit tester face them and just work down the row with the different fit test exercises. With COVID situation, we're trying to keep people at least 6 feet apart. So a more likely scenario is going to be the box with 4 individuals, 1 in each corner, the fit tester in the middle so they can rotate around to the different subjects. And then on the right here, we see more of the diagram of what I talked about in the last slide, where you have a room with traffic flow set up. So in the entry to the room, you have your sign in, then you go to your sensitivity test, which we'll talk about, your fit test stations, and then after that, you may have, if you have the resources, an extra person, someone to do troubleshooting. So let's say out of the 4 people, 1 person was having trouble with the fit test. So maybe rather than interrupt all of the fit tests for everybody, you would pull that person out and let the other 3 people keep going with their fit tests. And then you'd have someone work with the person off to the side who was having trouble. Maybe they didn't mold the nose clip properly, didn't have it positioned on their face, maybe they need a different make, model, or size. So maybe a designated person in an area to do troubleshooting so you can continue with fit testing the rest of the people at the same time. And then upon or prior to exit, documentation, so you can make sure we capture who was fit tested, and we'll talk more about that documentation at the end. Fit test hygiene. A lot of this is very obvious, but if someone is sick, have them stay home, have everyone practice good hand hygiene. We've already talked about with the COVID situation, having people stand 6 feet apart. The fit tester themselves should wear a respirator since they are going to be close proximity to everybody. For disinfection considerations, make sure that a fit test hood is used by a single subject, that they are using that same hood for their sensitivity and fit test. As the fit testing is being done with the nebulizer, you should wipe off the outside of the nebulizer with a disinfectant wipe between persons. And then after the fit testing is done, make sure you disinfect the inside of the hood before someone else uses it. If you're doing quantitative fit testing with our reusable respirators, that requires an adapter. So make sure you disinfect the tube that actually goes inside of the respirator prior to using it again. So I'm going to speak specifically now about the qualitative fit testing with the saccharin or Bitrex aerosols. Now these are available from different manufacturers. You can use different manufacturers' fit tests with different people's respirators. They all should be very similar because they all need to meet the OSHA requirements for these fit test kits, either saccharin or Bitrex. The part numbers for the 3M models are FT10, 20, or 30. FT10 and 20 are the saccharin, the sweet. FT30 is the Bitrex, the bitter. As I mentioned, I won't be talking much about the banana oil or irritant smoke. If you really want to learn more about these, I suggest going to the OSHA standard for respiratory protection, and Appendix A lists these in detail. So for the Bitrex and saccharin methods, a kit will include the following parts. There will be a hood and a collar that need to be assembled together. There are 2 nebulizers that go along with the 2 solutions. The sensitivity test is a weaker solution, just to make sure you can taste either sweet or bitter. And then the fit test solution is the stronger solution. But all of these come in a kit, and the kit also includes the instructions on how to do the test. So it should be pretty evident There's also training videos we have on our website. So to assemble, the hood and collar go together. The nebulizers, again, you need to keep track of the sensitivity and the fit test solution. So in our kits, the sensitivity is the red label, goes with the nebulizer with the red label. The fit test solution, the stronger solution, is black label, and then the corresponding nebulizer has a black label as well. So you would put just a very small amount of 1 ml into the bottom of the nebulizer, and then hold it up to the light. Now pull out the plugs, squeeze the handball, and you should see a cloud. If you don't, there's a problem. So one problem is that if you have the saccharin solution and it's crystallized, because it's a supersaturated solution, you may need to warm up the bottle, with the cap on, run it under warm water, shake it to dissolve all the crystals, and try again. Another thing that might be causing the issue is the nebulizer itself. Here's a close-up of the nebulizer. So with the cap off, there's a a question mark here, and there's a hole on the side where the arrow is pointing. If that is clogged, inside each kit, there's little wire plungers. So you can plunge out that hole. And there's also a little part that comes up out of the center of the nebulizer with a hole where the second arrow, the bottom arrow, is pointing. And that also can be plunged. So if you're having trouble generating a cloud of aerosol, that's two areas. You can also take this apart, wash it out again, plunge it, and then if both places are cleared out and clean, reassemble the cap, make sure the plugs on the side of the nebulizer are off, and then again, hold it up to the light, squeeze the bulb, and you should be able to see an aerosol. All right, this should be fairly obvious, but the saccharin and the Bitrex are aerosols. Therefore, they are used to fit test particulate respirators, not gas and vapor respirators like the picture of the cartridge on the far left with the X on it. That is a cartridge designed to filter out gas and vapors, not particles. So if you're going to be using a fit test that uses a particulate aerosol, you need to have a particulate respirator. Okay, we will continue with the mechanics of how to actually do the fit test. So for the sensitivity test, this is again with the more dilute solution. The purpose is to make sure that the individual can taste either the sweet or the bitter test, bitter solution rather. So we tell the subject to, again, have you eaten or drank anything in the last 15 minutes? And if they have, they need to wait, get a drink of water and wait 15 minutes before they do the sensitivity test. They would don the hood, but not the respirator. They would open their mouth, extend the tongue slightly, and let us know when they can taste the sweet or the bitter material. So here's a picture of this. This is a taste test, and the administrator needs to count the number of squeezes required. Whenever the subject tastes something, have them raise their hand, say stop, and the tester needs to remember then if they tasted something between 1 and 10 squeezes, we note that as 10, between 11 and 20, we note that as 20, between 21 and 30, we note that as 30, because this 10, 20, or 30 will form the basis for how many squeezes is needed for the actual fit test. Now, if they can't taste anything, again, we can go back to, is there aerosol being generated? So hold the bulb up to the light, squeeze to make sure you're still getting an aerosol. However, if that's working and they just can't taste the Bitrex or the saccharin, have them use the alternate solution. If they still can't taste either of those, then we could consider in some situations using another qualitative method, but they might want to go to a quantitative method. We talked about the porta count, or for elastomerics, the controlled negative pressure, or if they just can't use any of these methods, you might want to consider a loose-fitting PAPR, because as we described, those don't require a tight seal, and thus they do not need to be fit tested. Okay, so done with the sensitivity test, on to the actual fit test. Sometimes after the initial sensitivity test, they might want a drink of water, so have that readily available, and then have them put on the respirator, do the user seal check. So we have the picture here of the individual who's molded the nose clip to the nose. They've donned the respirator properly. They're now covering the front with their hands. Then we'll inhale and exhale sharply to make sure that there's no noticeable leaks. If that all works well, then they can wear it for 5 minutes to prepare for the actual fit test. So we have to remind the subjects that, again, this is a taste test, not looking for a smell. They're going to need to open their mouth, breathe through their mouth, that the respirator will filter out the particles, but if there's any taste, that means that there's a leak, and they must let the tester know. Now, for the tester, they need to be adding aerosol every 30 seconds, because as the individual is breathing in through the respirator, they're effectively cleaning out the number of particles inside the hood. So they have to replenish the amount of particles in the hood with these repeated squeezes of the nebulizer. There are 7 exercises. Each of them is a minute long, so you will need a watch or a clock to make sure that you're actually doing these for the whole allotted time. Now, again, you would make sure you have your fit test solution, the black label, and the black nebulizer. You know, squeeze the ball to make sure you're getting an aerosol, and we've talked about how to clean it out if it's not. So now we've placed the hood on the subject. They're already wearing the respirator. They've done the fit checks. Remind them to breathe through their mouth and let the tester know if they taste anything. Okay, you need to actually, for the tester, needs to put the nebulizer, there's a hole inside the hood, and so you'll put it in there to actually squeeze the aerosol into the nebulizer. So you don't want to squeeze the aerosol right at the respirator, so maybe angle it to the left or to the right. Now, from what we gleaned from their sensitivity, if they were sensitive within 10 squeezes, for the fit test, they will start off with 10 squeezes at the beginning, then every 30 seconds they will add 5 squeezes. If they were sensitive within 20 squeezes, we start with 20, and every 30 seconds we add 10 squeezes. If they're sensitive within 30, we start off with 30, and every 30 seconds we add 15. So here are the exercises. There's 7 of them. Each of them is a minute long. So normal breathing, deep breathing, moving your head side to side, inhaling at the far left or far right, moving your head up and down, inhaling at the up position, talking. There's a paragraph that's printed in the instructions called the rainbow passage. It uses the different sounds in the English language, or if that's too difficult for your subject, they can just count back from 100. Next is bending at the waist. Make sure you hold onto the hood so it doesn't fall off, or you can gently jog in place. And last is normal breathing. But the key here is remember that each of these is for 1 minute, but you need to add more aerosol every 30 seconds. So 2 squeezes effectively, or excuse me, 2 series of squeezes for each exercises. So if they pass, if they don't taste anything, you can have them remove the hood, but they should try to remember, how does this respirator look and feel on my nose, on my cheeks, on my face, the tightness, the location? You might want to have a mirror available so they can actually see how this looks on them. Because they emphasize that this is how you want the respirator to fit and feel every time you wear it. So again, it's not just passing for the sake of passing, but also it's a training time so they know how to use this appropriately when they go to use it. What if they fail the test, if they taste something? First of all, have them rinse out their mouth and wait 15 minutes for the taste to dissipate. Then you could re-don the respirator, readjust, or maybe it's obvious that they need a different size or model. And that's where you have this troubleshooting station where you can hopefully diagnose of what could be possibly the problem and the solution. If you've exhausted all these options, you could consider maybe a different type of respirator, maybe an elastomeric half mask or full face piece that offer other sizes or shapes. Or there's also the PAPR, the powered air purifying respirator with the loose fitting headgear that doesn't require a tight seal. So at the end of the fit test, this is just some practical advice. You would want to empty the nebulizers into the sink after you're done fit testing for the day. Don't pour the unused solution back into the bottles that would contaminate your stock solution. You want to take apart the nebulizers, rinse them in warm water to remove all the solution. If you're using a saccharin, OSHA says you need to clean them out at least every 4 hours because they do have a more likelihood of crystallizing. And you want to also use the wire plungers as necessary. After you've washed everything out, let it to air dry before packing it back up in the storage case, and then wipe down the interior of your hood. And again, for COVID applications, you're going to want to disinfect the inside of the hood, and you're also going to want to disinfect the outside portion of the nebulizer as part of your disinfection process. So after you've done your fit testing, you need to document when did this happen, who was the fit tester, who was being fit tested, what respirator make, model, and size they were fit tested on, the fit test agents, whether it's saccharin or Bitrex, or if you used a quantitative method, results that pass or fail, or any other comments. OSHA says you need to keep this until at least the next fit test. Now, mind you, under the OSHA respirator standard, they would require fit testing on an annual basis. You need to keep these records until the following year. We've talked about a lot today, and we have also a lot of resources available. So if you go to our main website for COVID, which is 3m.com/coronavirus, you will see other instructional documents such as what is the OSHA position on fit testing during COVID-19. We talked about how OSHA suggested that if you passed a fit on one respirator model, you might fit similarly to another model. There's a fit test hygiene. How do you keep your equipment clean and disinfected properly while you're doing the fit testing? We have a Center for Respiratory Protection that goes into other aspects of a respirator program. There's a quick reference guide to qualitative fit testing FAQs, a video on how to do fit testing. There's a tech dev bulletin on quantitative fit testing. There's even a shorter quantitative fit testing for the TSI port account that was published recently.